I'm very pleased to introduce Dr. Betsy Webb to this committee. Dr. Webb is the Superintendent of Schools in Bangor, Maine, a position that she has held since 2008. Under her guidance, the Bangor School Department has earned a national reputation for academic excellence. In 2013, Dr. Webb was named Maine Superintendent of the Year, a fitting tribute to her total dedication to her students, community involvement, professionalism, and fiscal management. In addition to being a well-respected authority on education policy, Dr. Webb also was the leader who brought to my attention the real-life problems that the 30-hour definition would cause in school systems. There's been a lot of focus on the for-profit world. She opened my eyes to what the impact would be on school systems across the United States. First-class education is a team effort, and Betsy is a top-notch team leader. As a citizen of Bangor, I'm very grateful for Betsy's contributions to our community and delighted that she's testifying before us today. I would also note, Mr. Chairman, that she got up at 3 a.m. in order to catch the 5:30 plane to be here today.
Well, thank you. Thanks, Senator Collins.
Thank you very much, Mr. Chairman. Dr. Webb, you did a terrific job of outlining what the impact would be on substitute teachers, on the ed techs, on people who are working two different jobs within the system. Could you talk to us about what the impact of the law's definition of full-time work would be on the students?
Absolutely. I first became aware of this when I was researching purchasing a software package to manage substitute teachers. And the salesperson talked to me about how the software would limit substitute teachers below the 30-hour in order to avoid having to provide health coverage. And I started thinking about the impact on learning. And when you consider, I think every one of us can remember having a substitute teacher in our classroom. The environment was different. The pace of learning was not the same. And there was a real give and take of getting to know that new person that was going to guide our learning. And so if you can think of, I would have maybe a teacher on maternity leave and have one substitute teacher from Monday to Thursday, but to avoid having that person go over the 30 hours, a different substitute teacher on Friday, what a huge concern that is. And I believe it's the full range of learners, whether it's the advanced placement class where students are following a rigorous curriculum with a high-stakes test in May that determines whether they are going to obtain college credit. Bangor High School had 544 AP tests last year, 80% of them earning college credit. I worry about changing substitutes in that room. But I also worry about the 54% of our students that are on free and reduced lunch status, and we know they have at-risk factors. And we know from research that the consistency of the person in the room and the relationship they have with that person has a great impact on learning. So to me, when I heard about this software tracking to avoid incurring additional expenditures, it didn't make common sense when considering the impact on learning.
Thank you. Dr. Webb, I was particularly struck when you described the 110 ed techs in your system who work between 30 and 34 hours a week and do in fact receive health insurance now, and the district pays 77% of the cost of the premium, and yet because of the way the Affordable Care Act works and the definition of full-time work, you will have to pay a third of up to a $3,000, no, it would be a $3,000 penalty for each of those employees. That's your outside risk, because the insurance that you're providing would not be considered affordable. Well, if my quick math is correct, that is $330,000 in new costs to the system. Now, just yesterday, the National Education Association sent me a letter in which it said that many school districts mistakenly believe that the only way to avoid the penalties is to cut employers' hours. And I would note the irony, because the NEA a year ago sent me a letter, sent all senators a letter urging a yes vote on a proposal that I made to the budget, calling for a more reasonable definition of full-time work. And in this a letter just a year ago said that it was a critical issue to their members, that educators face great uncertainty about their eligibility for coverage, et cetera. So there seems to have been a flip. But I guess I would ask you to respond to the NEA saying that you mistakenly, not you personally, the superintendents mistakenly think that cutting hours is the only option. Is asking for a huge budget increase a viable option for you and most superintendents?
No, that is not an option. And I mean, 95% of our employees are offered insurance, and the school department pays a large portion of that, anywhere from 77 to 80% of the cost. And there is no intention to cut hours of the people that are consistently employed, whether teachers or ed techs or custodians, secretaries, administrators. But where it becomes problematic is the affordability piece for the ed techs. And then those substitutes where we'd rather hire the core substitutes that really know the Bangor way. We have looked, we've researched the look-back method and, predicting the stability, a 90-day period ahead. My concern is the resources that would be required to administer that kind of a program. We hire substitutes weekly. I would say it's almost every single day someone is coming to our office with an application, and although we have a core group of substitutes, this past month we've been hit very hard with the flu. And so we've gone well beyond. And so you can imagine the administration kind of operation you would need to continually do a 6-month look back and to determine the 90-day ahead. And when we look at this calendar year for the school, which would begin July 1 to June 30th, and we have 5 months that someone could hit that threshold as a substitute of the 130 hours. So if we had someone on maternity leave at the beginning of the school year and the substitute that we hired worked during September and October, we would hit the 130-day threshold in both of those months. And so when I think of our system administration only being 2.4% of our budget, my fear is that resources have to be utilized one place or the other. And when you consider that 80% of our budget is personnel, we only have 7% of our budget that's truly discretionary. And so there lies my concern. Where do those resources come from?
Thank you.
Thank you, Senator Collins. That you wanted to introduce to the record.
I do, Mr. Chairman. I have letters from the National Association of Home Care and Hospice, which strongly supports this bill, as well as from the National Restaurant Association, that I would ask permission be included in the record.
Will be.
I would also ask permission that a written question to Dr. Holtz-Eakin be submitted that gets into an issue of the impact of the ACA on income inequality, and it picks up on a statement. I didn't get to that in my questions, and I would love to have a written answer to that as well, with your permission.
Thank you. Senator Murray.